I'm listening to the body when I put my hands on somebody. The body's giving me feedback. So some of the tools I use is, of course, manual therapy, which is manipulation, clinical massage with my hands, acupuncture, cupping, stretching, remedial exercises, heat, self-care techniques, trigger point release therapy, electroacupuncture, moxibustion. Very good question. How do I measure the effectiveness of my treatments? Like a star, needs a planet to reflect its light and its distance and its progress. In terms of its shining light, it's really the feedback that I get from the clients. It's the subjective response and the objective improvements that I see as a clinician. Proof is in the pudding. It's all about the results. Sometimes things are so simple as a practitioner because we've done them so many times, but for somebody in a different space, proficient in a different field, it's almost like a miracle. This Friday, I had a client that I was treating, and they've been living with what they call plantar fasciitis. Plantar fasciitis is a tendonitis. It's a tight muscle and a sore tendon at the bottom of the foot. Did some minor myofascial release. If you were looking at a distance, you would think I wasn't doing much because I'm essentially just grabbing the calf. Also educating the client on the source of, or the mechanism, we would say, of the injury. What's causing this pain? What are you doing within the week, within the day, that is contributing to this? And what should you stop doing, and what should you do to help prevent it? I did some trigger point release therapy, working on some acupressure points. And when you understand the body and you understand the source of the problem, and I'm listening to the body when I put my hands on somebody. The body's giving me feedback. Once I put my hands down, I'm saying, what's the normal consistency of this tissue? Because everybody's consistency is different. But once you establish what that normal consistency is, it's almost like dough or like porridge. You can find the lumps in the dough. You can find the lumps in the porridge. And those lumps are oftentimes the source of the problem. They're hypersensitive areas in the muscle tissue. They're called trigger points. So we call them acupuncture points, ashi points, or oh shit points. Right? So just work, particularly when it comes to muscle-skeletal issues. When it comes to issues affecting the bone, affecting the nerve, and affecting the joint. When you manipulate the tissue in a certain way, it naturally releases. I had a client who was a mixed martial artist, and during the course of a practice, fractured their lumbar spine. Really long recovery, got hooked on some pain meds, and overcame that with various natural remedies, which is a wonderful story, wonderful recovery story, but was still dealing with a lot of pain. With a consistent regimen of treatments for months, that person now is playing hockey, doing a lot of activities with their family, and they're just a superhero in their family's lives. So pain is the villain, and pain disturbs a lot of people's ability to do what they love and to be the superhero to the people that they love. So being able to just add value when it comes to musculoskeletal pain, chronic musculoskeletal pain, or joint pain. So how do I collaborate? I've been collaborating since I've been in this space. I've worked in hospitals, I've worked in clinics, I've worked in multidisciplinary spaces. And even if I'm not directly working with a particular healthcare provider, it's all the same. So when I'm working directly, it's just like a car. we all are doing different things to help this person holistically. Everybody's in their own lane and complementing each other and giving a perspective based off of their expertise. So we understand that the body is dynamic and that there has to be a dynamic, multidisciplinary approach to provide the most effective treatment for the client, because the client is multifaceted. Right? There's many layers to the client, like I alluded to before. You know, we're talking about well-being. You got physical, mental, emotional, social, environmental, spiritual. So being able to respect and complement each other's perspective is an easy thing. It's something that I've been doing for years. Of course, you always got one or two that are difficult to deal with, but you learn how to deal with that. Like anything in any one of our fields, we got some people that are easy to deal with and some people that are not so easy to deal with.